Hi, Professor. My name is Frida Stephanie Avila, and today I will be guiding you through my critical assignment of the Affordable Care Act, also known as the ACA. So let's get started. So the Affordable Care Act and its components, according to the National Conference of State Legislators, the NCSL, the Federal Patient Protection and Affordable Care Act was signed on March 23, 2010, and was referred to as a federal health reform. It served as a way to protect consumer goods and allow for more affordable health care. According to the National Center for Biotechnology Information, it aimed to expand healthcare coverage, preventative measures, and healthcare costs. And its final goal would be to improve overall quality of care and life being received by qualified patients. Now, some of the major components that are in the Act are healthcare coverage, preventative measures, and healthcare costs. According to Norris, increased access to healthcare allowed children to stay on their parents' healthcare plan until they are 26 unless offered insurance at work. According to the Centers for Medicare and Medicaid, the national program for people with pre-existing conditions would qualify after 6 months of being uninsured. And this also covers them from being protected from discrimination as well. Preventative measures such as community health care centers, would allow them to attend to over 20 million new patients each year, as said by Lundy. Healthcare costs would include a lot of investment from the states and the government, and just like locally. So funding for this, such as preventative measures as mammograms or colonoscopies, began in 2010 with a $15 billion prevention and public health fund, as stated by Habercorn. Next, we're going to look at the responsibilities. So, primary responsibilities fall on the states for implementation to improve overall healthcare system performance. Refusal for implementation would increase overall healthcare coverage rates in many states. States could also be given incentives for them to want to implement something like the Affordable Care Act. So federal funding would result in a gain if they were to participate in about $305 billion from 2013 and 2022, according to Norris. Employers may also face penalties and fines if they don't meet the minimum value or affordable health care of full-time employees. Next, we're going to look at the preventative structure of the Affordable Care Act. First, we have primary prevention, which is preventing disease and injury before it happens. According to Goldstein, this is most common within healthcare facilities. Next, we have secondary prevention, which includes more specific types of diseases and care to help patients. This is more common in doctors' offices, hospitals, and private practices. Lastly, we have tertiary prevention, which is dedicated to more complex and rare disorders that might be encountered. This is more trying to minimize the total damage already done to disorders and diseases to improve their overall quality of life. Next, we have the reforming structure. The Affordable Care Act has a structure that eventually trickles down and is a health system, insurance reform, or health care system reform. And it could also be both. So the health insurance reform, it wants to cover more people and have more benefits and protections and lower costs within governments and consumers. According to the American Public Health Association, it also aims to reform the healthcare system. In contrast, the reform aims to improve overall quality, a stronger workforce and infrastructure, and a greater focus on prevention and public health. Next, we move on to the role and impact of the Affordable Care Act. It is a major role in expanding access to over 20 million Americans in the U.S., according to the Center for American Progress. Next, the ACA also protects people with pre-existing conditions from discrimination, and this would include 135 million Americans that fall into this category. Also from the Center for American Progress, in 2019, 9 out of 10 people enrolled in a healthcare premium qualified for more than more than half of their coverage that they needed. Goodness, it's freezing again. Wait a second. Okay, some fun facts that I learned about the Affordable Care Act. The federal government funded most of the act and has the highest annual per capita health expenditures. The US also spends the most money but has the worst healthcare delivery, as stated by Reinhardt in 2015. Some fixes that I noticed that we could also take into account when looking at this act. Obviously, it's not perfect, so we could also redirect some of our other funds, such as military spending, because we do spend a lot of money on our military, and invest that into our US healthcare system. Also, paying more attention to detail and as to why many people are still uninsured today. So I think paying attention to the people that are being left out from the Affordable Care Act, and maybe it's also just a lack of education or information, may also help with getting them to know that they actually qualify for this act, may help as well. So this is the end of my presentation. I hope you enjoyed it. I really enjoyed your class, Professor, and I hope you can hear my audio in this one. I hope you can see all my references perfectly as well. I look forward to hopefully taking another class with you, and I really enjoyed doing this project. Thank you so much.